why it is that people are attracted to the Medicare Advantage plans. Why do they end up signing up for them?
Yeah, there's a variety of reasons. First of all, there's the fact that, CMS isn't putting out a bunch of advertisements advertising traditional Medicare. Well, Medicare Advantage companies, whether it be United Healthcare or Aetna, they're putting out ads. So they're literally doing the effort. But then there's the other issues, which are there are problems with traditional Medicare in that a lot of the upfront costs seem higher for traditional Medicare compared to Medicare Advantage. So I think the biggest thing is that, so if you're on Medicare Advantage, you have to pay your premium for Part B, but you have an out-of-pocket cap. So you're not going to spend over a certain amount of money. I think this year is over $9,000. You're not going to spend over that because the government requires this for these companies. There's no such requirement for traditional Medicare. So for Part A, for inpatient visits, there's a deductible for every stay you're in the hospital. It's around like $1,600. But after that deductible, after you meet that deductible, and if you're in the hospital for longer than 60 days, you can rack up more payments. And then for Part B, which is outpatient care, the government covers around 80% of the costs, but there's no out-of-pocket cap. So that 20% that the patient is paying can rack up. So for a lot of people, they say, "Oh, Medicare Advantage, there's a firm cap. There's often low or no additional premium. It just seems like the cheaper option." And then there's these advertisements which claim the immense benefit. They show happy families playing in a field. So it's a lot of emotional stuff and cost just up front.